care because they were at the top of the pyramid, so they're making all the money. At 11 o'clock, 11:30 at night, and then there's this meandering in of people that want to go through the logistics tent, take whatever they can, and, you know, people are people, okay? It always comes down to the lowest denominator. Lowest common denominator. Isn't this always true? You went to Harvard, you should know this.
Yeah,
Well,
I just understand, but anyway. Yeah, well, the whole place is kind of the lowest common denominator. I mean, I don't know.
Well, that's
I
what
haven't been impressed
the
so far,
lower,
but
the lower in the denominator that you can get to, the more to the truth you're gonna become. And so if we walk around and go, do you want to live here? Do you want this going on around you? Meaning bad things or good things? And well, you know what? I would rather have good things going on. I'd rather have people helping each other.
yeah.
And we're supposed to be about a cause that is supposed to be about bringing to light, which should be apparent to everybody, that there is a problem with America right now, and that why is the concentration of wealth at this level? We've formed this pyramid, and we just had this Madoff went to prison because of a Ponzi scheme, and Wall Street would have you believe that, okay, you know, if you buy a house, you're going to be set for the rest of your life. Well, you know what? What killed them? Toxic mortgages. Why? Because they were selling mortgages to people that couldn't afford them. And instead of doing any kind of background checks, they'd give you the mortgage. Really, I know it's more complicated than that, and I'm oversimplifying and whatnot, but basically,
It's even worse than that, actually.
it's
more credit card.
they didn't care because they were at the top of the pyramid, so they're making all the money.
Yeah.
So they don't care about anyone
And they're
below
able to
them.
sell somehow you're able to like sell the mortgages to, I mean, but so I wonder, like, do you see as the next step actually?
Veterans. And I thank you, brothers and sisters, for the opportunity. My name is Katie Murphy. I'm a member of the Massachusetts Nurses Association, the National Nurses Association, and Mass Care, which is an umbrella group in Massachusetts working for single payer. Thank you very much. I'd like to start out by saying that America's nurses are alarmed. We see broad declines in health and living standards among our patients, their families, and our communities. Declines that are caused by the lack of jobs, people suffering from poor nutrition, or people who are losing their homes or retirement savings. We're here because we can no longer be silent about our patients who are refusing life-saving medical treatment or reject diagnostic procedures or postpone taking medications because they can't afford high copays and deductibles. Just last week, the Commonwealth Fund released a report showing that America trailed most other nations in the cost of care and its impact on access to care for its sicker patients. More than 1 in 4 were unable to pay or encountered serious problems paying medical bills in the past year, compared between 1 and 14% of adults in other countries. In the U.S., 42% of our citizens reported not visiting a doctor, not filling a prescription, or not getting recommended care. This is twice the rate for every other country but Australia, New Zealand, and Germany. You'd be healthier. We're here because we see the crisis in our own families, too. Spouses, adult children, brothers and sisters who can't find jobs or can't get health insurance. We're here because Washington has largely abandoned our communities. Too many politicians would rather cut programs that help people take the steps we need to reclaim the American dream. That's why we're fighting for a Main Street contract for the American people. That would mean jobs at living wages, good schools for our children, protection from homelessness and hunger, a secure retirement for everyone, and yes, guaranteed universal health care for all. Thank you. We at the Mass Nurses Association and NNU believe that the current health care system in America is broken and beyond repair, and the only real solution for America is to finally join other industrialized nations in the world and move to a single-payer health care system. We're here because Wall Street got bailed out and Main Street got left out. We're here because soup kitchens and homeless shelters should not be the fastest growing business in America, because medical bills should not be the leading cause of bankruptcy. Big banks, investment houses, and other financial giants who wrecked our economy, who gambled with our mortgages and pensions, need to return some of that enormous wealth to Main Street. It's time to take it back. Nurses have a plan. A tax on Wall Street financial speculation could raise hundreds of billions of dollars to fund the programs we need to put America back to work and protect our homes, our schools, and our health. We propose a sales tax on all major Wall Street financial activities, such as billion-dollar gambling on our dividends, credit default swaps, and futures that put our economy in ruin. The fastest-growing markets in the world already have such a tax, and even conservative leaders, including the President of France and Premier of Germany, have proposed it for all of Europe. Why should we be left behind again? Again, we thank you for your courage, and we applaud the commitment of Occupy Boston to speak truth to power. We, like you, will not go away. We will not be silent, and working together, we will heal America and restore the American dream. Thank you.
Read to you a statement of solidarity that this sort of new formed health justice group wrote, and if you would like to sign it and have it, please visit Health Justice Boston and sign your in support as well. So as we wrote, as Massachusetts health advocates and providers for the 99%, we stand with Occupy Boston and similar movements across the country and around the world. We are outraged at the accumulation of wealth by the few at the expense of the many, and the appropriation of our government by corporations that value profits over people. The skewed distribution of resources in the U.S. reflects deep-rooted illness in the fabric of our society and inflicts serious health consequences. We gain strength and inspiration from the UN Universal Declaration of Human Rights, which affirms the rights of all people to food, clothing, housing, and medical care. Despite such internationally recognized declarations, we bear witness to the fact in Massachusetts, tens of thousands of our neighbors have no health insurance and whatsoever, while millions more find themselves increasingly unable to afford necessary care. Hospital CEOs and insurance companies accumulate unprecedented wealth and power, while nursing work hours are cut to unsafe staffing levels. Medical debt remains, after job loss, the major cause of personal bankruptcy nationwide. Budget cuts to the Massachusetts mental health system have eliminated vital services and have led to higher rates of ER visits, hospitalizations, homelessness, and incarceration. As Medicaid and Medicare budgets are slashed, we remain the only nation in the world whose government refuses to negotiate the prices of patented medications. Though we spend more than a third, again, as much per capita on health care than any other nation in the world, we are the only industrialized nation that fails to provide universal health care. Currently, we rank 46th internationally for infant mortality, with approximately 6 deaths for every 1,000 children born. These terrible losses are not shared equally throughout our society. Here in Massachusetts, even with the rates that are lower than the national average, infant deaths are twice as high for black families than among whites. We will not be silent in the face of such injustice. We believe that an honest pursuit of the right to health requires a comprehensive, national, single-payer healthcare system provided automatically to everyone. The assault on the health of the 99% extends beyond medical care. For poor women across the country, barriers to healthy lives and families are further compounded by legislation that carves away women's reproductive rights. Stripping workers of collective bargaining rights and reducing environmental regulations have made the U.S. a less safe place to live and work. The loss of millions of homes to foreclosure has been directly correlated with an increase in suicide attempts. Harsh anti-immigrant legislation creates a climate of fear, which prevents families from accessing essential services and undermines our public health. In our current recession, 25 million Americans are unemployed or underemployed, and there has been a drastic 32% rise in food insecurity. We seek to defend the human rights of all of us, especially those most vulnerable by systemic injustices. Only through collective action can we tackle these social ills and truly promote the health of the 99%. To this end, we offer our support to the Occupy movements in Boston and around the globe, and pledge to work together to build a new society, one which protects and advances basic rights for all.
Well, this is off the cuff, and where I'm going to start is to riff off of the gentleman who lost his son because there was not good mental health care through the VA system. And I'm one of those treaters, psychologists, that should have been available to him and all the vets and everyone. People who can't afford insurance are often the ones that can use these mental health services the most. So why aren't I available? I'm not available because of this. This is managed care. Managed care, and they're an arm of the insurance company. And what they are is gatekeepers to make sure that you don't get services from me because they cost money. Now, the saddest thing about wearing this shirt today is I dug it out of the mothballs from almost 20 years ago when we tried to put forth a single-payer system and get managed care and insurance out of the healthcare system, and we failed. We failed. So I gave up trying. And so now I'm inspired by Occupy to come back with some energy. So I want us to start a scratch and sniff policy. What is scratch and sniff? Look, I don't think any of us is smart enough or has the experience to really have the data. But we do have the smarts to ask for the data. So scratch and sniff is about when you sniff something going on, to scratch at it, to ask the questions. So here's a few I have. How much profit have insurance companies made from the healthcare system? Right? How much profit? How much? And how many of the 45 million or whatever that are not insured, how many of those people could have been treated, gotten health care? Somebody's excited as I am. So, so I come here today to support you, and one other story. TRICARE. TRICARE is the managed care company that reimburses services to providers, mental health services, for the vets and for the military people. I just got an application to join those panel, and I turned it down because the reimbursement rate is the lowest of all the insurances. The reimbursement rate, which may sound like a lot, is $70 per client. That means I sit with the client for an hour, and I get the $70, and I pay my secretary, I pay my office, I pay everything. It's a gross. And I don't necessarily get paid. When I provide the service, then they may or may not pay me, depending on if I do everything perfect in the forms, to send the forms back. And then, oftentimes, I have to call to figure out where's the check. I don't get paid. I lose about $10,000 a year in insurance money, work I've done, the money I don't get. I am so angry. I am so angry at the insurance system for raping us of health care. I'm done.
Health care!
sidewalk. What do we do? Stand up, fight back! The people's health is under attack. What do we do? Stand up, fight back! Hey, Mr. Political Hack, give our corporate bailouts back! Hey, Mr. Political Hack, give our corporate bailouts back! Hey, Mr. Political Hack, give our corporate bailouts back! John Kerry, don't you dare! John Kerry, don't you dare! Kerry, can you spare a cent for the 99%? Can you spare a cent for the 99%? 99%. Thank you, everyone, for congregating here at the State House. First, we have a speaker for the Massachusetts Nursing Association.
Okay, you heard my very good colleague, Katie Murphy, talk a little bit about the nurses and healthcare. I'm not going to repeat what she has to say. I'm going to maybe extend it a little bit. I remember 30 years ago, when I was fairly new in nursing, how good it was, how good I felt going home from work, having given quality care, a high standard of care, with the patients to their families. Not too many years after that, that quality of care became impossible to give. But what happened? Well, first, job re-engineering consultants came in. The number of patients I had to take care of escalated. The managed care revolution came along, and patients were working through the system quicker and sicker and going home. In 1991, I remember very much, the Democratic Senate chair of the Joint Committee on Health Care pushed through the deregulation of hospital finance, and of course teach the doctors how to organize, and we managed to raise such a stink that the worst aspects of managed care were driven back, at least for a few years. But what's happened since then? Privatization, deregulation, this absurd ideology, this absurd belief that the marketplace solves all your healthcare problems.
I'm just here to talk about how corporate healthcare does not work for transgender people like it doesn't work for a lot of other people. I don't want to see any more of my friends in my community sitting wondering if when their gender marker gets changed to male, can they still get their pap smears? I don't want to see people wondering why their health care that their doctor says is medically necessary is excluded from insurance coverage. And I don't want to see people without the ability to get basic health care, just like all of us here. None of us want to see that. I'm asking all of you today, just to cut right to the chase, to do one thing to help the transgender community. We all know that housing, that employment, that access to basic public services is really important for our health. And the transgender community right now is waiting. We're waiting for the Transgender Equal Rights Bill to pass.
Hi, I'm Deborah Shell, and I'm a bisexual, transsexual, consensual physician in Somerville, Massachusetts. I suffered great shame over my transsexuality. It's not easy to come out to yourself and to others. And then I realized that I wasn't even able to get health treatment for my health plan because I'm transsexual.
Thanks. Greetings from Vermont, and you know,
Louder.
People think that we passed a single payer bill in Vermont, and what we passed is a bill that intends to become a single payer bill. So we have a lot of work to do.
Make yourself heard.
Can you hear me?
Yeah.
All right. I was asked to just give you some suggestions for how you can move in the direction that we're moving in, and you people, in some respects, are way ahead of us in Massachusetts, but we're all working for the same goals. And clearly, if we all push for a single-payer bill, we'll all be making a lot of progress. Even if we don't exactly get to where we want to be, we're still working there. What have we done in Vermont that's helped us get there? As in Massachusetts, over 20 years of grassroots health organizing. and we had a slow evolution of the formation of coalitions. Coalitions are the key to progress, the key to political progress. And remember that ideological purity doesn't always help. You know, we have to be a little bit impure to make progress. And there are goals we can all agree on, the affordability and access of health care. And the fact that we create a system that lets people live instead of die. We can all agree on that. And there is, and one of the very important political issues that we must keep in mind is whenever we deal in public forums such as this or with the media, we have to remind the politicians how many voters we represent. Because in Vermont, that has made a big difference. The big coalition that I have been a part of represents a third of the state's voters, 200,000 people. Whenever you speak in Massachusetts, you have to remind the politicians that you hold their future in your hands.
Yeah.
I think this is a lesson for the Occupy movements all over the world, all over the country, all over the state, is that they need to let the politicians know how many of them vote.
Yeah.
And that they're going to influence their fate. And they may be jobless soon. You need to show that power.
Yeah.
And we need to keep using the tactics we've been using, and of course use the social media tactics. Every time people talk about reform, especially in Massachusetts, you need to haul out at least one fact about single payer, the economics. The economic argument is the key to this ballgame politically. That's where you're going to win. These people are only going to listen to money. Only going to listen to money and numbers. And the case is there. We don't have to create the case. It already exists. We just have to remind them because they have such a short attention span. We did have something unique in Vermont that may not exist here and maybe someday, but we had a governor who actually used single payer as a plank for his platform to get elected. And we have a legislature, both chambers, that are on board with single payer. However, just so you know, our governor did not embrace all the principles of single payer. He simply said, and continues to say, and continues to make sure his people say, we're coming at this purely from an economic point of view, and we're going to help businesses. There's nothing wrong with that argument. We can talk about the other stuff later. But it's the economic, and if I leave you with no other message, it's that the economic argument needs to be strong, forceful, and repeated.
Yeah.
Because we're dealing with people with short attention spans.
Yeah.
Thank you very much. And now to one of our last invited speakers, Ben from SEIU.